We are here today with Jason Joseph, Chief Digital and Information Officer at Corewell Health. Jason, thank you so much for joining us today.
Thanks for having me, Jordan.
So Jason, I'd like to talk about the transition that Corewell is planning to undergo that will bring the healthcare system closer towards the Intermountain and UPMC payer-provider model of care. What has been driving this shift at Corewell?
Yeah, so our legacy as an organization is Corewell Health is the combination of Spectrum Health System and Beaumont Health. And as particularly on the Spectrum Health System side, Priority Health, which is our provider-sponsored health plan, has been a part of that strategy for 20 or more. And so really this is an expansion of that payer-provider integration strategy. As we move forward into the future, I think so much of our focus really is not only around integrating and thinking about how do we improve care and coverage, but really how does the business model work into the future? I mean, healthcare right now is kind of in this interesting transitionary period, trying to wrestle through these fee-for-service models, value-based care, and how is this going to wrestle out? And I think at the end of the day, when you think about it from a consumer perspective, healthcare is kind of these things bundled together, right? How I get my coverage and how that manifests in terms of the care and the different services I get and the amount I pay and the copays and the services and the quality are all really fundamentally intertwined. And so as we think about it from a Corewell Health perspective, we're just moving towards kind of forward with that idea that that is the centerpiece. It's not the only part of our business. Certainly we provide care to people on other health plans, insurance, et cetera. And we have people on our health plan that are seeking care elsewhere. But there's also this kind of ability to do that a little bit better, we believe, as we do it together in an integrated organization. That's kind of the future that we see coming together in what we're growing for.
So the Healthy Data podcast audience is much like yourself, CIOs of large healthcare systems around the country, some of whom, many of whom, most of whom actually don't have a Priority Health. They just represent a hospital, a healthcare delivery system. There's no payer involved at all. Some may be listening to this and they're intrigued. And they say, yes, I've been experiencing a transition away from fee-for-service. I have maybe an ACO. I understand value-based care and risk sharing. And what I'd like to know is, Jason, could you tell me, what do you think I should be doing to move my organization in that direction so that we're not left behind?
Well, I think value-based care at its core is really about doing the right thing for the patient or member and looking at ways to actually increase the value, right? Thus the term. So, better outcomes at a lower cost. And what it really comes down to is who gets the share of that value. And I think the difference when you have that integrated system is you can kind of not worry so much about which side of the ledger you're counting those wins on. You can say, let's do the right thing. And if that reduces our cost on the health plan side, but actually reduces our volume on the care delivery side, which reduces revenue, well, as long as it's the right thing to do and overall it reduces the total cost of care, we win. And then it becomes more of an exercise about how do you make the interchange more efficient? How do you actually take the costs out of the system? It's just a bit harder when you don't have that and you have to be in that negotiation. So if you don't have that other side, I think it's really about getting a collaborative relationship and getting on the same page as a provider, as a payer, and saying, look, we're all in the same game here. How do we come up with something that allows us to experiment a little bit? And if we win by actually taking costs out of the system, how do we share in that win? That's ultimately the goal, and that benefits everybody all the way around.
So, Jason, as Chief Digital and Information Officer for Spectrum Health, your previous position before the merger, you implemented an integrated clinical and revenue cycle system, and you grew a regional health information exchange. Would you walk our listeners through an anecdote or two from these two experiences?
Yeah, I've been in this business long enough, and many of us have, to kind of go through the transition from multiple non-integrated EMRs and clinical systems to kind of consolidating that. And so we went on that journey and are landed really on a singular instance of Epic, plus many combined third-party systems as a Spectrum Health entity. And as we've grown Corewell Health, that's still our strategy. So as we grow, we're doing that same strategy. We're integrating that on that common. So it's really, to me, it's a foundational requirement for innovation in the future, right? It's not to say every situation is that same, but if you really do want to be able to scale innovation, you want to be able to operate your organization consistently, especially in a value-based world, it's just become that much of a drag and that much harder to do it when you've got every change has to be made multiple times. And so that's a foundational strategy. We went through that starting with our ambulatory outpatient facilities, grew really big in ambulatory or physician practice, and then brought our hospitals on board as well. And that was kind of our journey there. In terms of the HIE, this has been a kind of a passion and a focus for a while. It's that connecting of all the parts of the healthcare system. And as big as integrated systems are, we aren't representative of 100% for sure. And so the HIE was really grown out of how do we get away from this living, which is like faxing each other like crazy, and start to digitize that. And that's that health information exchange work, which we were really pioneers on some of the technology that grew into our regional health information exchange and then ultimately our statewide health information exchange to kind of bridge those gaps in coverage that the large systems couldn't do on their own between each other or with their kind of aligned providers and connected facilities, but really kind of bridging what I call the last mile of healthcare and making sure that as much of that data is flowing as possible.
So some CIOs of comparable health systems around the nation have had difficulty finding a way of making an HIE financially viable. They found it to be more of a cost center than a revenue center. What would you say to those individuals who maybe want to actualize the value of an HIE, but who are having a CFO batter down their door and say, where's the value here? We're providing value to these external entities and there's data sharing and cybersecurity. So how do you respond to that?
I think the value of the HIE was to be a profit center of any sort, right? I mean, one of the challenges, just editorial comment, is healthcare can't all be about every piece of it, turning a profit or making a margin. Sometimes you do things because they're necessary to make the whole system work. And to me, HIE is a necessary part of making the whole system work. And the beneficiaries of that really often are health plans who may be able to improve quality. They're certainly the patients and the members in the communities that they serve to be able to have their information flowing. The health systems are a big part of that, and a lot of HIEs are set up to be funded that way, but they're not necessarily the ones who are say the beneficiary of that, but they've needed to fund it. So I look at the HIE infrastructure, and I've been appreciative that our big vendors have stepped into this and made it easier for us to connect amongst themselves with kind of core capabilities of the HR. Some of the regulations have actually moved us more in that direction. So I think the HIE frameworks are going to kind of have to adapt to say, all right, what is the gap in the problem we're trying to solve? Not being everything to everybody and having a high cost model to have to support it. I think that's the transition that many people are probably trying to go through right now.
So Jason, on another topic, more operational, kind of related, but more specific on the operations, you've championed the implementation and adoption of Agile methodology to enhance Spectrum Health project prioritization and execution. How have you measured the impact of Agile?
Agile is an interesting one. We've been on what I call an Agile journey maybe for 10 years, although it wasn't called that back in the day. It was really just called getting all the people in a room, we call it fixed teams at the time, right? Where, we have so many different priorities in healthcare, so many different ways of thinking about it. And usually we work really well in tickets, we work really well in projects, but really more and more, we need to think about things as a value stream we're delivering. And, we actually started this and kind of led this journey from our health plans perspective, because there's just more software development lends itself well there. I will fully admit we are not to the point where I would start to say we are an expert in it, but I definitely think we're on the leading edge of moving in this direction. And really what it is it's about us getting the ability to manage capacity and demand in a meaningful real-time discussion with the people who are decision makers and the people who know best as to what can be done. In that gap, we put all sorts of processes in the middle with different methodologies, and we still have that in some areas. But boy, when you can really shrink it down to that, I think the benefit and the measurability is it does become measurable, right? We have velocity metrics and we can trend those over time and see how we're much more predictable in what we can deliver. And we can make prioritization decisions on a 2-week notice timeframe, which, in other ways, sometimes like, oh, you got to think about that next year. This is really important, but we got to talk about it later. It just allows us to be more adaptable. And once you can get into that ongoing conversation, right? Keeping a list of all the stuff you're not doing just makes you mad. Looking at the things you are doing and staying focused on them really allows you to feel like you're moving the needle and gets you more into that rhythm of getting the things done today that need to be done today. It's just a healthier way to operate.
So, under your leadership, Corewell recently earned the highest marks of any healthcare organization in the country in the 2022 College of Healthcare Information Management Executives, which is CHIME, Digital Health Most Wired Survey. What does this mean to you, and what would you advise CIOs of peer institutions about how to go about following in your footsteps?
I appreciate Chime putting this out, and no offense to them, but we never like go out and study for that test. Like this is something we do what's necessary to advance our organization and do the best things for our communities, for our patients and our members. And we have a very digitally focused strategy. And I think what's happened is because of the combination of those two things, and when you bring that together and say, hey, Chime, how are we doing? We've fared very well in there. And that's been a focus for us on our inpatient world, but also very much on our outpatient, our post-acute, which is why the combining of that really rose to the top. And we're very proud of that. I think it just really demonstrates the expertise and the focus and the investment of our teams and, quite frankly, our clinicians and leaders in advancing digital technologies with a purpose. But it's not something we really walk around saying, oh, we're going to do that next year. It doesn't show up on our goals. It's just something that we're proud of. But, the proof is in the pudding in what we deliver to our communities.
So many providers have been, well, you find many providers now who may be retiring, who when they began their career in the 70s and 80s didn't interact with EHRs too much. They had paper charts, and they've seen the entire progression over the last 4 or 5 decades of from paper charts to electronic health records and all the digital oriented strategy that we've been discussing. Some providers have questioned the value of electronic health records. They have said that it may have adversely impacted communication between patients and the providers in the exam room, and it was more for research. I wonder, how would you encapsulate the value that we've been seeing or that you've been seeing as a health system over the last decade and a half through your digital forward strategy?
This is a mixed bag because on one hand, I think there are so many improvements that have been enabled. The speed to get a lab test done and results back, like 20 years ago, that was a tube system and there was runners and there was, today it's real time and the patient has that information the minute that lab test via automation comes out the back end. It's amazing. So I think there's so many innovations and advancements that whole digital infrastructure has allowed for that are really big improvements. But at the same time, I have a lot of empathy for our clinicians in general because the combination of, I think, two things. One is the increasing rigor required to get paid to do what we do in healthcare. And the increasing regulations that are required to get it done has put burden on our clinicians to document more, to explain more. And I honestly, when I look at much of that information that gets there, some of it is absolutely clinically valuable and relevant, but it's harder and harder to parse out how much of that is necessary for the clinical benefit versus how much is necessary for all the other supporting processes. And that isn't, I think, a fault of the health systems. I think it's the result of the game we're playing in. And I think it's something we collectively do have to be very aware of and continuously pushing on because it's a balance, right? When you're running on razor thin margins and trying to produce high quality and meet all these requirements, that burden stacks up somewhere. And that's where I think we have to be very acutely aware, look for ways of leveraging AI and automation to improve it. But we also have to be realistic about how much of this burden can we put on health systems and on our clinicians in general, and what is the benefit versus the cost of doing so. And I think that's what people are feeling. I'm sure generationally it has a big difference because people just grew up with that expectation. But I certainly can't look at 100% of it and say, yes, as a physician, as a clinician, as a nurse, everything you do is 100% about care. There are other things in there that have to do with the other things that are necessary, but it's harder to understand. So I think we have an opportunity as an industry, quite frankly, to make that better for everybody.
So Jason, we are approaching the end of this podcast. So I'd like to open it up to you to talk about You've worked on myriad issues from medical devices, cybersecurity, emergency preparedness, digital platforms. I'd like to open up to you and talk about maybe one of the projects you've worked on that you'd like to highlight, or any thoughts you'd like to convey to CIOs who are listening to this episode.
Well, it's hard to like pick something that, I would focus on and highlight as a project per se. What I would say is that I think strategically, one of the things that CIOs should be really thinking about is complexity is the enemy of innovation. And much of our organization, many of our organization have grown. It's kind of like a hospital building, right? They're like Franken buildings, right? They're weird. They got weird corridors, and the A level doesn't match the B level, and you've got these different things. And our technology ecosystem isn't always that different. And so part of what we have to be like relentlessly doing is simplifying down that core, making sure that we're not making decisions to trade off tech debt, right? To say we're going to take on more and more tech debt because we want to do these things, because those innovative things can't scale if you don't have that ecosystem underneath of it. And so I'm really proud of like some of the things that we've done with AI. I mean, we've actually got some studies recently where we've taken our collection of data and actually allowed ourselves to grow some AI competencies that are really improving our predictability of outcomes and improving patient experiences with AI and predictive algorithms. I think on the digital front, we've probably been a pioneer, not only on just like the virtual digital health side of things, but also really connecting experiences and allowing people to automate as much of their care journey and self-serve their way through that as possible. All of this stuff is important, but I think as we move into the future, more and more and more, the organizations that don't think holistically about their ecosystem and how it all works together are going to find it increasingly difficult to innovate, because so many of these things are dependent on each other. They can't just be solved by point solutions with features and functions.
Jason, I'd like to thank you again for joining us. This has been Jason Joseph, Chief Digital and Information Officer of Corewell Health. So Jason, thank you very much for joining us on the podcast.
Thanks, Jordan. Appreciate the time.